Aromasin 25 mg tablet, also known as Exemestane, is a medication used to treat certain types of breast cancer in women after menopause. It is particularly effective for hormone-receptor-positive breast cancer. It is also used to help prevent the cancer from coming back. Some breast cancers are stimulated to grow by a natural hormone called estrogen. Aromasin works by decreasing the amount of estrogen produced by the body, which helps to slow or reverse the growth of these breast cancers. It is important to note that aromasin is usually not used in women of childbearing age. The recommended daily dosage of aromasin is 25 mg, and it is typically taken once a day after a meal. It is best to take aromasin at the same time each day to maintain a consistent level of the medication in the body. Always follow the instructions of your healthcare provider regarding the timing and dosage of aromasin. Before you start taking Aromasin 25 mg tablet aromatase inhibitors, be sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with food, usually once daily as directed by your doctor. The dosage will be based on your medical condition, response to treatment, and other medications you may be taking. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day. Since this drug can be absorbed through the skin and lungs, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Make sure to inform your doctor right away if your condition worsens, such as if you get new breast lumps. Some common side effects of Aromasin 25 mg tablet aromatase inhibitors include hot flashes, hair loss, bone pain, tiredness, unusual sweating, nausea, diarrhea, dizziness, and trouble sleeping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as nausea or vomiting that doesn't stop, bone fractures, pain or swelling in the joints, muscles, or tendons, changes in mental or mood, vaginal bleeding, unusual tiredness, dark urine, or yellowing of the eyes or skin. In rare cases, this medication may cause serious problems related to blood clots, such as a heart attack or stroke. Seek medical help right away if you experience symptoms such as sudden shortness of breath, chest, jaw, or left arm pain, confusion, coughing up blood, sudden dizziness or fainting, pain, swelling, or warmth in the groin or calf, tingling, weakness, or numbness in the arms or legs, trouble speaking, swelling of the arms or legs, weakness on one side of the body, vision changes, or a sudden, severe headache. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as a rash, itching, swelling of the face, tongue, throat, or neck, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the US, for medical advice about side effects, contact your doctor or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, for medical advice about side effects, contact your doctor or report them to Health Canada at 1-866-234-2345. Before starting Aromasin, make sure to inform your doctor about any allergies you have and discuss any inactive ingredients that may cause allergic reactions. Also, let your doctor know about your medical history, especially if you have high blood fats, bone problems, heart disease, high blood pressure, kidney or liver problems. Aromasin may cause dizziness or tiredness, so avoid driving or using machinery until you know how it affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. Before any surgery, inform your doctor or dentist about all the medications you are taking. This medication should not be used during pregnancy as it may harm the unborn baby. It is mainly used in women after menopause, but if you are near menopause, discuss reliable forms of birth control with your doctor. Do not use birth control products containing estrogen. If you become pregnant while taking Aromasin, inform your doctor immediately. It is not known if this medication passes into breast milk, so it is not recommended to breastfeed while using this drug and for 1 month after stopping treatment. Consult your doctor before breastfeeding. It's important to be aware that Aromasin 25 mg tablet aromatase inhibitors may interact with other medications, which could impact how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Aromasin 25 mg tablet aromatase inhibitors include estrogens, such as ethinyl estradiol, conjugated estrogens, and estrogen blockers, such as anastrozole, tamoxifen, tibolone. Be sure to discuss any concerns about potential interactions with your healthcare provider. If someone has taken too much Aromasin and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. It's important to not share this medication with others. While taking Aromasin 25 mg tablet aromatase inhibitors, it's important to have lab and/or medical tests done, such as bone density tests, cholesterol levels, and liver function. Make sure to keep all medical and lab appointments and consult your doctor for more details. This medication can increase the risk of bone loss, osteoporosis, so it's crucial to talk with your doctor about your risk and available treatments for osteoporosis. Lifestyle changes that can help reduce the risk of bone loss include doing weight-bearing exercise, getting enough calcium and vitamin D, stopping smoking, and limiting alcohol. When taking Aromasin 25 mg tablet aromatase inhibitors, it's important to follow your doctor's instructions on daily dosage and the optimal timing for taking the medication. If you forget to take a dose of Aromasin 25 mg tablet, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Remember to store Aromasin 25 mg tablet aromatase inhibitors at room temperature in a place away from light and moisture. It's important to keep it out of the reach of children and pets, so make sure to store it in a safe place. When it's time to dispose of the medication, don't flush it down the toilet or pour it into the drain unless instructed. Instead, properly discard it when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.